Delayed cord clamping. So what does that even mean? After your baby is born, they are still connected to the placenta via the umbilical cord, and there is some blood flow within that umbilical cord even after birth. That additional blood volume that's transferred to the baby is known as placental transfusion. We used to recommend immediately clamping and cutting that umbilical cord after birth, and the idea was to reduce the amount of blood that's lost during childbirth. However, immediate cord clamping does mean that up to a third of the baby's blood volume is still in that umbilical cord at birth and it doesn't get transferred to the baby. That can mean that the baby loses out on up to an extra 20 to 30 milligrams per kilogram of iron. The idea is if we delay or we wait to clamp the cord for a couple of minutes if possible, of course only if it's safe to do so, that we increase the amount of blood that's transferred back to the baby. Why do they need that extra iron? Well, term babies who have immediate cord clamping have been shown to have some lower iron stores for up to 6 months after birth. Now, most healthy babies at term will adapt without any major consequences. It's a bit more important to have that extra boost to their iron levels if a baby is born preterm or if they've got any health concerns, if they have an infection. The idea is that a brief delay in clamping and cutting the cord will increase the baby's iron stores and blood volume. The longer you wait, the more blood is transferred to the baby, and that can help with their circulation and improve their blood pressure. What are the downsides? Well, jaundice can be more common if you delay cord clamping. However, the benefits should actually outweigh these risks, as long as you're in a place also where phototherapy for jaundice is available. Delaying cord clamping can make early skin-to-skin difficult because of gravity. So what we actually sometimes need to do, especially if there's a short cord, is keep the baby low, so between the mother's legs, for example, until it's time to clamp and cut the cord, and they can be placed onto the mother's chest. Also, in emergency situations or in a cesarean section, sometimes it can be risky to the mother or to the baby to delay that separation. So if the baby's born in poor condition, they need immediate intervention, then we should just clamp and cut the cord straight away. Or if the mother is bleeding heavily, then again delaying the cord clamping keeps the placenta inside and means that she'll continue to bleed until that placenta is removed. So if the mother is bleeding very heavily, we would not delay the cord clamping either. What about the guidelines? Well, actually, FIGO, the World Health Organization, all no longer recommend immediate cord clamping. In the UK, where I'm based, NICE recommends that for healthy women where the baby is born at term at the end of pregnancy, you should aim to wait 60 seconds to up to 5 minutes to clamp and cut the cord if you can. So what do you think and what happened in your birth? Let me know below.